Arthritis and Joint Pain, When Movement Hurts.
Hello, everyone. Welcome back to our next podcast session. As you all know, today we have Dr. Sandeep, Chief Ayurvedic Practitioner, Nirava Holistic Center, and Krishna Ayurveda Hospital. Today, we'll be talking about why your joint aches is just more than age. So, we meet so many people who say, it's just age, my knees are gone. But is arthritis really about aging?
So, not entirely. The word arthritis simply means inflammation of joints, but the causes differ. So, the two most common types of arthritis we know is osteoarthritis and rheumatoid arthritis. So, OA or osteoarthritis is where the cartilage wears away because of overuse, obesity, trauma, or weak muscle support. In rheumatoid arthritis or RA, on the other hand, it is an autoimmune condition. Here, the body's own immune system attacks the synovial membrane, releasing cytokinins. This causes swelling, stiffness, and even destruction. So, OA is wear and tear, RA is inflammation and miscommunication of the body.
So, why do women seem to suffer more than men in terms of arthritis?
Yes, that's a nice question. In women, hormonal changes play a big role, particularly declining estrogen after menopause, which weakens bone and cartilage repair. So, add to that modern stress, sedentary jobs, vitamin D deficiency, and even inflammatory diets, and you have the perfect storm. In Ayurveda, we describe this as Sandhivata for degenerative arthritis. So, excess Vata drying up the joint fluids, and Ama or Amavata for autoimmune arthritis. So, now the toxins mixed with the Vata dosha, and this settles in the joint, creating this pain, swelling, and stiffness.
So, you're trying to explain that in Ayurveda, the ama is similar to systemic inflammation in modern medicine?
So, ama is that sticky, toxic residue of poor digestion and sluggish metabolism. It's similar to the low grade inflammation and oxidative stress that modern science speak of. When this toxin accumulates in the joints, the body responds with pain and swelling. So now you can compare it to the way cholesterol clogs the arteries. Only here, toxins clogs the joint channels, or srotas that we call in Ayurveda.
That is such a beautiful explanation to it. So, could you tell me what are the main triggers that you observe in patients?
A few patterns repeat, like irregular meals, heavy and fried food, or prolonged sitting, poor posture, stress, sleep deprivation, and even all of this causes aggravated vata. And also cold, damp weather, sudden cessation of movement after injury or surgery, and sometimes over exercise without adequate recovery. In both cases, the joints lubrication or the sneha dries out of it.
That's excellent knowledge again. So, could you tell me what is the Ayurvedic treatment protocol that you follow for arthritis?
So we follow a three-phase integrated protocol. The first protocol is detox. Here we clear the inflammation through detox programs like Virechana or medicated way of purgation to uh, to remove the excess pitta and the toxin or ama from the gut and liver. Second type of detox is called as Vasti. Vasti means enema. It's a medicated enema which helps to reduce the vata in the body. It also nourishes the spine and the joints. So, along with it, we do external therapies like abhyanga or mild massages, along with Potli treatments. Potli means herbal hot packs, which helps to soften tissues and improve circulation. All of this helps to reduce the localized pain and muscle spasm. Now, the second module will be the rejuvenation or re-lubricating the joint. So, we have therapies where treatments called as Januvasti, where oil is retained like a well on the knee, which the oil poured in it, the micronutrients in it, absorbs into the joint to improve the quality, that is, which is found to be really effective. Third module is the rehabilitation module. This is basically done by restoring the movements. So, movements can be done through mild yoga and also physiotherapy. Correcting the weight and gait through exercise and diet. Even stress management through mindfulness and pranayama is very important.
That's a very comprehensive learning for me. So, could you tell me how do you integrate it with modern medicine?
So, integration is vital. For osteoarthritis, we preserve joint function with physiotherapy and muscle training, while Ayurveda improves lubrication and reduces pain. In rheumatoid arthritis, patients may continue their medicines in allopathic format, but along with that, Ayurveda helps in detoxifying and reducing the flare up frequencies. And also, we need to monitor the CRP and ESR as well as the RA factor, along with the vitamin D to evaluate the progress.
So, can arthritis be reversed or it can just be managed?
So, degeneration can't be completely reversed, you might know, but it can be stabilized and sometimes partially regenerated with proper oil therapy where micronutrients help this to do that. And also, the muscle strengthening part can be improved through Ayurveda. Inflammation driven RA or rheumatoid arthritis can be brought to into remission. The goal is not just pain free movement, but freedom from a fear of movement.
So, what is exactly non negotiable here in terms of diet?
So diet is a very integral part here. So avoiding certain food like sour foods, curd, fried snacks, or excessive tomato and cold water, which is giving cold as a feeling to the body, generally to reduce it, is very important. Taking warm cooked food with a dash of ghee is always recommended. And again, ginger, turmeric, garlic are considered very good for this. And for RA patients, limit the night shades and processed sugar, and also hydration and early dinner are key. So the simpler the food, the smoother the joints is what we say.
So, what about painkillers? Do you think the patients can stop them?
Painkillers have their place but should not be the crutch. Once inflammation settles and the tissues are re-nourished, patients find they naturally need less. So the body becomes its own analgesic when lubrication returns.
That's a beautiful session. I think everything was very simplified, and I think the listeners also understood it in all very good terms. So, is there any closing line that you would want to convey to our listeners?
Of course, arthritis is not just age, it's imbalance of movement, metabolism, and mindset. So, when you nourish instead of neglect, the joints remember how to move without pain. So, pain is not punishment, it's the body asking for care.
Thank you, everybody, for listening to our wellness podcast today. Please join us for more sessions like this.